Yeah, we will start the program. So, welcome to the academic program. The R2R program is basically meant to spread the sensitization among the caregivers, persons with mental illness, as well as NGOs, as well as mental health professionals. So we started in Psychiatric Rehabilitation Services last many years. We are following every month. Last week of Friday will be there in different topics. Our main intention, objective of this program is to network among the professionals as well as the NGOs, and also how to maintain the advocacy among the needy people and also with the government organizations. With this intention, we are continuously doing this kind of program. We encourage the caregivers as well as persons with mental health conditions to participate in this program. At the same time, we are also encourage the students to participate because we will learn new things and ground level realities also will try to understand. This month we have invited two organizations. One is CBM India Trust as well as WOTR Program, WOTR India Trust. This is both the organizations are working in the rural area. So that's the reason we made one statement like the title is also Agriculture and Dairy-Based Rehabilitation in Mental Health Conditions. So we will see actually how we can able to refer to these patients who are all coming to our OPD and coming to the who are admitted and PRS, especially rehabilitation settings. So it will help us what kind of referral we can able to make it. That will help for students as well as mental health professionals. So I request the Darshini to give the brief introduction about both the organizations. I think three presenters are there. I request the three presenters also make specific time because we have to cover the time also. And I request all the audience, please mute. And if there anything queries there, please put it in a chat box. We'll allow you to ask directly, or we can also read the chat box in the end of the presentations. So I request maintain the discipline. So we will see and we'll wait and watch about their organization details. I request Darshini, please go ahead.
Good afternoon, everyone. On behalf of the Psychiatric Rehabilitation Services, I warmly welcome you all to today's Road to Recovery program. Today's session is on the theme Rural Pathway to Recovery, Agriculture and Dairy-Based Rehabilitation in Mental Health. We are privileged to have esteemed resource persons with us today from two different organizations, CBM India and Watershed Organization Trust. CBM India is a leading development organization since 1967, working towards building an inclusive society where persons with disabilities are respected, included, and supported to reach their full potential. They work across various sectors such as health, education, livelihoods, and humanitarian actions, focusing on addressing systemic barriers and creating sustainable, inclusive change in collaboration with communities, governments, and partners. From CBM India, we are honored to have Dr. Rufus Singh, lead for livelihood programs. Dr. Rufus Singh is a seasoned development professional with over 17 years of experience in community development, humanitarian action, and inclusive livelihoods. With a background in social work and agriculture, his work focuses on sustainable development and climate resilience. In addition to his field experience, he has served as an associate professor at the Madras School of Social Work, contributing to teaching, research, and academic development. We also have Mr. Shiva Mohan Rao, Senior Officer, Training and Accessibility India Inclusion. He is an experienced professional with over 25 years of work in disability inclusion and the rights of persons with disabilities. He has been working with CBM India Trust since 2008 and has contributed extensively across areas such as inclusive education, livelihoods, and accessibility. He is also a trained access auditor and has conducted audits of over 300 buildings, in addition to training a wide range of stakeholders, including government officials, NGOs, and grassroots workers. The other organization is Watershed Organization Trust. It is an internationally recognized non-profit organization and think tank established in 1993. Over the past 3 decades, it has been actively engaged in promoting sustainable rural development, focusing on water security, climate resilient agriculture, and livelihood enhancement. The organization has reached over 6.9 million people across more than 7,000 villages in 10 states of India, significantly contributing to watershed development, regeneration of degraded landscapes, and improving farm incomes and agricultural productivity. From Watershed Organization Trust, we are joined by Mr. Sachin Adhe, researcher from the agricultural team. Mr. Sachin Adhe is an agriculture professional with expertise in climate resilient agriculture and sustainable farming practices. He has extensive experience in training farmers, NGOs, and stakeholders, and has led multiple agriculture and forestry projects focusing on sustainability and livelihood enhancement. We are truly grateful to all our speakers for taking the time to be with us today. Now, I would like to invite our moderator, Dr. Shanivaram Reddy, Additional Professor from Department of Psychiatric Social Work, to kindly take the session forward. Thank you.
Thank you, Darshini. I think you have given a brief introduction about three people from the two organization. Now I request Rufus Singh, you can go ahead, sir. We are handovering to you. I request you to briefly explain about your program. What is the program today? We have titled Agriculture and Dairy-Based Rehabilitation and Mental Health Setting. That what you have done from your organization. Then we'll followed by the discussion from the participants. Go ahead, sir.
Thank you, Professor Shanivaram Reddy. Thank you for introducing. I hope my, entire audibility is clear.
Yes, it's audible, sir. Clear.
Okay. I request my colleague, Mr. Shiva, to give the introductory speech. Then I will follow with the agriculture part.
Good afternoon, everybody. Thanks for that introduction. And as we were just discussing about the work of CBM, so I would like to take you through a small presentation where we would like to tell you what exactly CBM does in the field of disability and inclusion. So I have a small PowerPoint presentation to show you. This is about the work of CBM India. So in India, like we are an organization which is a leading disability and development organization. We have been working in India for the last it's more than 55 years now. So we started somewhere in the year 1967 in India. So we have been working across different states, and we are a pan India organization, and we have a presence in rural and very remote areas. We work in tribal communities. We work in very difficult terrain areas. So we work in different states of India, like it can be state like Himachal, Uttarakhand. It can be state like Sikkim, Manipur, Mizoram, many states, northeast states. Yeah. So CBM is actively involved in the disability inclusion, and disability inclusion is always our mantra across whichever development sector that we talk. Yeah. So I'll just take you through this presentation now. Slide number.
Yes, slide number 2.
Okay. So CBM is actively involved. We have India entity, what we call it as CBM India Trust, We are a registered organization. We registered as CBM India Trust in 1994. It's almost more than 32 years now. We have been working, and we are one of the leading disability inclusion organization, which is promoting disability inclusion across various sectors. Like, for example, health, education, livelihood, whether it is empowerment, whether it is in terms of disaster management programs. So we are one of the leading NGOs in the country. These are some of the statistics we are just trying to show you here. In India, we have more than 2.68 crore persons with different disabilities. These are very old statistics, I would say, like 2011 census. It tells about what is a rate of persons with disability, the amount of magnitude of the problem we have. And as you know that in 2016 we had this new Rights of Persons with Disabilities Act coming in. So the number of disabilities have increased from 7 to 21 now. So definitely the magnitude of the problem is very, very big. And the data tells 45% of people with disabilities are illiterate. There are very, very less number of people who have access to job. Very few people have access to assistive devices. Very small percentage, 3%, 5%. It's like almost very, very minimum. Yeah. Next slide, sir. Yeah.
Yes. Third slide.
Vision and mission.
Yeah.
So our vision and mission statement. So our vision talks about the world where people with disabilities can actively participate and contribute to their full potential. Yeah. So we talk about a world where we preach and practice inclusion. Yeah. Be it in the sectors of healthcare, in terms of education, in the sector of livelihood, skill development, and so on. So the mission statements talk about inclusion of people with disability. We have been practicing, and we have been training, and we are building capacity of many organizations, many NGOs and INGOs in this country. So we have a vision mission statement which talks about including people with disabilities in every walk of life, giving opportunities, which opens doors for people with disabilities to participate to their full and effective way they can contribute in the society. Next slide, sir.
Yes. Okay. Is this? Yeah.
The statistics.
Yes.
Right. So these are some of the statistics about CBM. So we reach out, some numbers, something like 2 million population. It's more than 2 million population. This is people with and without disabilities. And when it comes to people with disabilities, we reach out to more than 1 lakh population in this country. So we have programs in terms of eye care, which is our major, portfolio that we have. We work a lot on prevention of avoidable blindness. So we concentrate on, some of the eye problems, like for example, it can be cataract, glaucoma, it can be on diabetic retinopathy, and so many other, problems. So we have, number of people that we are reaching out every year. So these are some of the statistics that we have. Yeah, in total. Next slide, sir.
Yeah. Focus areas.
Yeah, the focus areas, what we have. These are the focus areas. For example, we have the first one is that is our biggest strength, inclusive eye health programs. We have focus areas like addressing the physical disability. Especially, we work for the foot correction programs. We have education. We work for promoting inclusive education across the country. We also have programs to do with skilling. As you know, that skill development is one of the major area without which people with disabilities find it difficult to get opportunities to livelihood and income, access to income. Yeah. So these are some of the our focal areas. Next slide, sir.
Yeah. Young Samad.
Right. This is one of the story we have about a boy. He's from a place called Nandagudi. So who had this problem of keratoconus. So he had, one of our vision center which identified this boy, and we identified this boy at a very young age, and we had a surgical intervention done for this boy, and very soon the correction was done, and then he's now able to do his education. So this is one of the story that we thought of presenting. It's one of the success story of a young boy who we were able to do intervention through our eye care services. Yes, sir.
Right.
Next slide.
Inclusive education.
Right. The second biggest portfolio that we have in CBM is inclusive education. So we have some of the statistics here, in front of you. Every year we in a lot of people, a lot of teachers, especially teachers on inclusive education. We, work with schools. We work with, especially with the mainstream schools. We train a lot of teachers. We develop a lot of teaching learning material. We have also developed a lot of training material on inclusive education. These are some of the numbers. Like every year, we reach out to children with disabilities. Number of capacity building trainings for inclusive education teachers and so on. Next slide, sir.
Yes. Yes. Anupam.
There's a story again. Anupam, who was struggling to go to school because of the difficulty in his eye, and he had problem in education also. And because of this, due to an accident, and then because of problem, he also developed intellectual disability. And because of our intervention from the inclusive education program, he was identified, and then there was this training, and he was given education, and then he was able to successfully complete his 10th standard education. And now he is able to do his higher education, and he's also doing other training programs also. Yeah, this is one of the success story we thought we will present in this discussion. Next one.
Livelihood.
Yeah. So there is a number of livelihood interventions. We reach out to thousands of people every year. We train a lot of people on skill development. We have a lot of skill development trainings. We have farm and non-farm training programs. We train people on agriculture. We also train people on beekeeping, mushroom cultivation. We have something called organic farming. We also have a lot of training programs, which Rufus sir will be covering in depth. So we will be talking a lot about our livelihood programs. And before that, we have mostly our interventions are in rural areas. So we focus more on the rural-based livelihood activities. So these are some of the numbers, and then what are the training programs what we have in the rural areas. Next slide, sir.
Yes.
Sorry. Yeah, this is one of the story which we thought we would like to present. This is a lady who has been very active in the Sundarban region. So we work in the Sundarban region, and she has been very active in terms of planting the saplings. CBM has a big program in terms of addressing the climate change. As you know, that India is one of the country which has been very much disturbed by a lot of climatic changes, especially last year. If you observe, we have faced a lot of disasters in this country, be it because of floods, because of cloudburst, because of cyclones hitting our country, and there are a lot of natural calamities that happen, and of course there are also some human-made disasters also. So we do a lot of disaster response programs, and we also try to see that these disaster response programs are disability inclusive. When we talk about disability inclusion in the DIDRR, that is disaster risk reduction programs, we want to see that people with disabilities are actively involved and participate in the disaster preparedness program. We train a lot of persons with disabilities on the disaster preparedness programs. It can be on early warning system, it can be on shelter management, evacuation, rescue, and evacuation plan. We ensure that accessibility is ensured across, when it comes to disaster management programs. And we have also responded to many disasters, last year, and in the past also. We have been responding to many disasters in this country, and we also supported hundreds and thousands of families across different states in this country to make sure that people with disabilities are not left out from the disaster management programs. Next slide, sir.
Yes. Humanitarian action.
Right. So these are some of the statistics that we have, like what we do in terms of humanitarian response programs. We have a lot of, as I mentioned, a lot of response programs that we did. We responded for example, for the Assam flood response program, Bihar floods. Last year, we responded for this Uttarakhand flash floods that happened because of the cloudburst and other things. So we have been responding to many of these kind of disasters, natural disasters that are occurring more frequently in this country. Next slide, sir.
Yes. The story my roots are.
Right. So there's again a story about the how we are responding to the disasters, and how we have been um, supporting in terms of addressing the climate change program. Yeah. Next slide, sir.
Inclusive play and sports.
Right. So this is another portfolio of CBM. We support a lot in terms of sports and recreation activities. We have also had this privilege of construction of a sensory park, which is very well received by the Calcutta Municipal Corporation. The land was provided by the municipal corporation, and we also developed a sensory park. And apart from that, we also support a lot of para athletes in this country. We ensure that young athletes get support financially. They should get access to good nutrition, health care, therapeutic support, doing their physiotherapy and so on. And also in terms of getting access to the sports material, to different technology in the field of sports and equipments. So we make sure that they go and participate. And recently, we also had a lot of laurels. People receiving gold medals and silver medals, and because of our support. So we are very happy about that. The people, the para athletes have really performed well, both nationally and internationally. So we are very proud about the support that we have supported them. Next slide, sir.
So this is regarding the supporting para athletes.
Right. So this is again about the para athletes who performed. Yeah, there are some of the quotes that we have received. How people, who got support from our, para athlete program. So people have given very good response and feedback about our support. Yeah. Next slide, sir.
Capacity building and accessibility.
Right. So capacity building, we are one of the, as I said, disability inclusion organizations. So we support a lot of capacity building training programs in this country. We train a lot of government officials. We also train a lot of corporates, NGOs. We train teachers on inclusive education. We train frontline workers, especially the ASHA workers, Anganwadi workers, on identification of disabilities, especially like identification of eye problems. We have a lot of vision centers across the country. We support almost like 200 plus vision centers. So we do a lot of capacity building in the area of eye care, in the area of inclusive education, in the area of accessibility. Accessibility is one of our portfolio, and we are one of the empaneled organization under the Ministry of Social Justice and Empowerment, under the Department of Empowerment of Persons with Disabilities, Department of Divyangjan. So we are an access auditor under the Accessible India, that is the Sugam Bharat Abhiyan campaign. And we have carried out more than 300 access audits of various government and non-government buildings across the country. So we have done access audits of schools, we have done access audits of court, judicial buildings, stadiums, parks, museums, hospitals, universities, colleges, police stations. We have done access audit of buildings like a zoo, museum, parks, telecom department, and many others, bus terminals, primary health centers, and so many. And I'm one of the lead access auditor, as Sri Darshini was introducing. I lead the team, and I've been actively involved in conducting access audits of hundreds of buildings across the country. So we have done access audits in states like Assam, Meghalaya, Delhi, Uttar Pradesh, Gujarat, in Telangana, Andhra, Karnataka, Maharashtra, states like Tamil Nadu and all. We have done access audits of collector buildings, tourism buildings. We have done access audits of bus terminals, including Chennai Metro, Bangalore Metro, Delhi Metro, and so on. Yeah. So we have a big list, and accessibility is one of the important area when we talk about inclusion. Without having accessible environment, we cannot ensure that participation of people with disabilities is very difficult. Yeah. Next slide, sir.
Yeah, empowerment also.
Right. So this is what about where I was talking about the empanelment of CBM India Trust under the Accessible India campaign. So we have been leading, and we have also trained a lot of civil engineers, architects in this country. We have trained government officials. We have also developed a lot of training modules on accessibility, workplace accessibility, and so on. And we also ensured that these e-learning modules are also accessible, and people who are using keyboard can use, without support of a mouse, people can navigate with their keyboard. So we have made sure that these e-learning modules are accessible for all people. It's very easy to navigate actually. Yeah. Next slide, sir.
Very nice.
So these are some of the awards and recognitions that we have got. We have got awards, Zero Project Award in 2017. We have got Best NGO awards, serving in the sector of eye care, in the area of disability inclusion. So we have got all these awards and recognitions in our record. Next slide, sir.
Video.
Yeah, we have a short video to play. So we wanted to show and highlight some of the areas of our work. So Rufus sir will play a small video for us. Yeah, and then
Yeah.
yeah.
Hello. Is the audio you're able to listen?
No, audio. Okay, sir. We watched, but the voice was not there. It's okay. You can
Okay.
go to the next.
Yeah, fine. Okay.
Rufus, I think
Yes.
the next presenter is also there. I
Okay.
request focus on the rural related program.
Okay. Okay. Okay, we'll move on. Yeah. Okay. Okay. Yeah.
Yeah.
So I'll move on with my presentation.
Yeah, please go ahead and briefly explain the case studies and all. It will take so much of time. Better to avoid those things. Rufus, go ahead.
Yes, sir. One minute. Okay, so this is the experience of CBM. As Shimon sir talking about the entire CBM journey in the area of inclusion. I don't know. I'm still hearing Singh an echo. Just hold on.
No, your voice is clear. You can go ahead.
Clear? Yeah.
Yeah.
Okay, sir. Okay. So this project which I am going to talk about is community-based, sustainable, inclusive dairy farm, which we have implemented in Madhya Pradesh and also in Uttar Pradesh. Okay, we are reaching out to 2,000 dairy farmers. Our approach was inclusion in all aspects of our engagement. Inclusion is our approach. So the milk production is the main source of income for marginalized farmers, including those with disabilities. Adopting newer technologies in breeding, housing, feeding, rearing, and healthcare will lead to marked growth in milk output. So this is our key focus area. Our major highlights of this entire project, what we have done, we have, whenever we engage with community, we engage them collectively as group, wherein as significant persons with disability are part of the group, which helps them, enable them for development to happen within the group. That is one of the approach. We use the word inclusion, including them as part of this group. So we also technically use the word FPOs, Farmer Producers Organization. Any FPO, we have an approach of inclusion where significant persons with disabilities are part of the board or part of the members. So through this, our interventions are reached to the community. And also we engage inclusive SHG groups, and we have exclusive OPDs are engaged. These are some of the approaches we do as a collectively, as a group we engage. This gives them enormous support while we engage them in the field. So one of those projects which is focusing on dairy farming, where the communities are identified. We have, before engaging, we do a detailed baseline research, and we come across the issues for all the beneficiary that is identified, including the type of disabilities. All these are identified. That way, it helps us to engage them in the respective activity, understanding their challenges. While we engage, we also understand the supportive devices which is required. So we also give them assisted device. Some of the farming activity which needs some of the tools to be modified. Sorry. Some of the tools to be modified. So we also do reasonable corrections in the equipment, which can be made accommodated, accessible to persons with disability. And we have also engaged paravets. Paravets are young people available in the community who are ready to serve as a cattle health management persons, and they are trained and they are available to provide services. And 2 barrier-free sale outlets were also formed, and this helps them to collect all the milks from the respective villages. So there is an entire set of value chain we have adopted for this particular project. So we have also established a one fodder production unit where we make pellets of fodder. It is easy to store and also to transfer. And we also see persons with disabilities are able to engage in most of the activities. And we have milk collection centers. We, in the remote areas, we also ensure this is also accessible for persons with disabilities. And we had developed cattle sheds. Then we have also done artificial insemination related interventions, then green fodder production unit, hydroponic unit, and some of the chaff cutters, and also developed some cattle health management app. So we have gone from traditional tools and also an additional technology which really enable all the dairy farmers to come together and develop as one society. So in the inclusive dairy value chain, we take into several stakeholders into consideration while we process the entire project. And we also does the group formation very systematically, regularly monitor, and their activities are appraised. And we also give training programs. So regular training programs and capacity building programs enable their knowledge and skill on the respective domain. And such practices will also result in a great psychological health. So this is, as I discussed, we form groups we engage them through groups. We also engage them as individuals. And if I take you through some of the activities, you will understand. These are some of the initiatives part of the entire project. So inclusive self-help groups, organizations for persons with disabilities, financial linkages, cattle health insurance, cattle vaccination, cattle insemination, cattle screening for health camp, cattle sheds, then feed production and FPOs. See, these are some of the key aspects of the entire dairy farming. Yes. The important part is at the regular intervals, having them engage and collectively in the respective village through meeting, discussions, and training programs. It is very, very essential. And the main challenge is the persons with disability to make them ensure that they take part in the meetings. And this time in many of the villages, we saw that the community has normally thought that persons with disabilities cannot be very productive and also cannot contribute. But when they were involved, they were able to give the best of skills and contribute for the family income and also for the social development. These are some of the images of scientific cattle shed and the products made. They not only milk, there are other koa and other the milk products were made. They've also started a milk parlor. We have arranged for a milk ATM, which is mobile. We reach out to the people, and also a mobile health van. Whenever there is a issue of health concern, we have a veterinary doctor and the para-veterinaries. They go and reach out to the community. And the enterprise production unit, where we thoughtfully engage persons with disability. This will actually help community to understand persons with disabilities are able to contribute productively for the community, where community earlier thought that they may not be able to make it. So we made significant difference in the people's life, the respective community. Moving on to one of the successful approach where our agricultural activity can make a difference in persons with disabilities life. We form OPDs as a key important part of the project. Engaging them on training, and they are also elected as board member. They are registered as a self-reliance cooperative. They got their FSSAI, MSME. So formally they are registered. A board is formed. Members are formed. They will have regular meetings and they engage in income generation activities, which really enable them to become self-reliant. And you can see the one of the project in Almora district in Uttarakhand, we were able to make this impact in the field. And one of the activity which we are showing is the beeswax sheet making. We did a study, we understood there are a lot of beekeeping farmers available and many of them are trained. What they need is beeswax sheet. So we trained the community to make it. Even the one sheet cost is very humble in money, but still it makes a difference. This is the production union where OPD members are engaged. I'm just flipping the slide. Pickle making. So we are also trying to make them understand it's not only a skill development, it also need to reach out to the market. So we will try to train them, capacitate them to reach out to the market, which makes them sustainable and self-reliant. This project we developed within a year of time. The team was developed, capacitated. Now they are independently running their own unit. They have made a brand. It's called Marty. Yeah. This is the unit, and they have reached out to the market, and they find a space in this particular geography. These are the branding materials. All comes from the field, Dory team along with the OPD team. And the first earning of Miss Sangeeta Arya, and when we meet her, and she was on tears because first time she got this recognition that family allowed her to go and work, because there are team of people who are having challenges and they are taking part in this activity. And this is the first income she received. And she never thought that she will be able to earn money. And we also into other agriculture activities across different geographies. For example, in goat rearing in Karnataka, Madhya Pradesh, UP, or in Uttarakhand, in many parts of India, wherever we work in livelihood, we ensure that livestock-related activities are encouraged. So we usually identify beneficiaries and we develop business plan and we reach out to them and give them training and we try to support them. These are some of the training photographs. This is in Sundarbans, West Bengal. And the goat distribution again in Sundarbans. This you are seeing the goat farming beneficiaries again Sundarbans. Beneficiaries, yeah. Goat farming beneficiaries, yes. And we also intervene on pisciculture related training programs. And in all training programs, all set of livestock or livelihood activity, we ensure person with disabilities are engaged. I'll just flip through this photographs here. These are our intervention areas. Pisciculture, goatry, and also in poultry farming. Then training program, vaccination. And one of the key aspects, many of our training programs focused on, and intervention is also focused backyard farming. Backyard farming really helps us to reach out to very needy people, those who don't have very big land to have agricultural activities. Feed distribution. We also encourage beekeeping. When it comes to agriculture, we are actually getting into many of the technical areas, including mushroom farming, multi-layer farming, horticultural related activities, aromatic agriculture. So there are a lot of areas we intervene. This is multi-layer farming, which helps them to get the yield within a short particular area. And also we connect with them with the government schemes, with various schemes, how we can converge during this project time. These are some of the areas as an entire livelihood activity and humanitarian response. We'll find all the different areas. Why agriculture and dairy? How it is connected to this today's discussion? Because it helps us to connect people with the routine and responsibility, and it sensibly engage all sensory organs, connecting to soil, animals, and nature. It also helps in stress reduction. We call it as evidence-based ecotherapy. That is also done while we engage people thoughtfully in agriculture and dairy. Improved physical activity, which also improves one's mental health. Community integration, which we largely decreasing now in the current scenario, and which will also helps and develops certain skills, motor skills, emotional bonding, social skills, financial literacy skills, and much more. So such engagements really take people for overall development, social development, economic development, even mental health as well. Thank you, everyone.
Thank you, Rufus. I think you presented within a stipulated time. You presented very meaningfully. Any questions related to presentation? I will give around 1 or 2 questions. Then we will move on to next presentation because lack of time. You can also ask in the chat box. We can able to read. Okay, we will move on to next presenter. Darshini, you can coordinate. Rufus, you can close your PPT. Yeah, somebody is asking whether CFM is working in Karnataka. Yes, it's working actually. Which area? Rufus, which area you are working? Rufus? Is it audible, my voice?
Yes, sir. Yes.
It's going on.
Rufus, somebody is asking in which part of the Karnataka you are?
1 minute. Yeah, please. Okay, you have a question in the chat box. Okay. 1 minute. Do you also have agriculture or milk farm programs, urban settings? Individuals with disabilities who may be from urban areas would also benefit from such training and opportunity. Okay. To clarify, CBM works largely in rural sector and tribal villages. We also engage in urban areas. May not be in agriculture, but in some areas we identify there are poor households where their backyard is utilized for agriculture. In Karnataka, in Jigini area, we are working with farm-based households, and we are reaching out on backyard poultry, backyard goatry. These are some of the areas we are trying to reach out.
Thank you.
Thank you. Yeah.
I just want to add to Rufus. We are working in different thematic areas. The areas that Rufus mentioned is about livelihood, whereas in health, we are working in more than 3 to 5 districts. And in CBID training, we are working in more than 13 districts in Karnataka.
Yeah. Thank you, ma'am. Thank you for the clarification. We move on to next presenter, I think from the WOTR organization. Rufus, can you close your PPT slide presentation? Yeah, Sachin, you can go ahead now.
Yes, thank you.
We can able to see. Yeah.
Okay, thank you. Now is it visible?
Yeah, go ahead.
Okay. Good afternoon to everyone. It's a pleasure of WOTR to be here today. We sincerely thanks Nimhans for giving us this opportunity under the Road to Recovery program. Today I will briefly share how agriculture and dairy-based livelihood can support the rehabilitation activities for the mental illness. Currently WOTR working 10 states, 89 districts, and more than 8,000 villages. So, in these villages, WOTR working core activities related to the agriculture, uh, promoting promoting the livelihood activities, implementation activities, training and capacity building, and also helping for the nations regarding to the research and policy advocacy. So currently we are working in 10 states in India, one is Rajasthan, Madhya Pradesh, Chhattisgarh, Bihar, Karnataka, Maharashtra, Telangana, Jharkhand, Odisha, and Andhra Pradesh. In Karnataka, we are currently not working in entire state, but 3 to 4 district we have covered right now. One is the Bidar, Vijaypura, and Gulbarga. So in these villages, we are working mainly watershed activities, watershed conservation, agriculture implementation, climate resilient agriculture, and livelihood activities. So currently we have touched more than near about 7 million lives about the our interventions. Uh, Near about 4 million hectare land treated, and more than 8 lakh people we have trained through the training and capacity building program. And we have established 72 FPOs, which is right now fully functional. And we have supported more than 21,000 SCGs and empowering 2 lakh 50,000 women through the promoting this such kind of activities run by WOTR. So directly we are moving to the next slide to related to our presentation topic. So WOTR empowering communities through sustainable livelihoods. The WOTR mainly promoting sustainable livelihood activities like empowering youth, marginalized communities, supporting agri-allied and non-farm livelihood options. Currently we have 5 thematics for the promoting livelihood activities. One is livestock-based livelihoods, fishery-based, agriculture-based activities, rural micro enterprises, NTF-based livelihoods, and then skill-based livelihood opportunities. WOTR promoting these 5 livelihood opportunities in entire where WOTR is working, and these 5 component livelihood activities run through the every project. Means sometimes identify the key villages regarding the livestock based opportunities. Then they set up in the dairy farming, then goat rearing and backward poultry activities. Before that, setting any livelihood opportunities, they identify the key person from the villages, which one is the very needy for them. It means sometimes water not giving support directly to the rich people in the village, or even they don't have to give direct fully fund for the promoting livelihood activities. Sometimes they promoting identify 5 youth from train for them to promote dairy-based farming. Other another 5 identify youth and also women farmer, train them for the goat rearing farming, and next another is a backward poultry farming like that. So every key thematic working water is helping to the uh, throughout the villages to promoting livelihood opportunities. And also same here the for mental illness health program activity. Also we can implement such type of activity for uh, the person who came from the mental illness health. So it will be direct emotional touch for them to keeping busy throughout the run activity related to the livelihood opportunities. So main focus about that the agriculture based activities, which is means the orchard based floriculture, multi-layer farming and kitchen garden. This one the most engaged livelihood activities along with emotion touch for the many of us, which is we directly come from this background. So next one is a rural micro enterprises, which means small scale agri allied services enterprises we have promote through the livelihood program. Next one is a NTF. NTPF means non-timber forest product like honey, bamboo forest, bamboo product. We train people from the villages or carpenters also. They prepare their own product within the village, and through the large krushi melas or workshops or exhibitions, what are helping them to produce their product in Krushi Melas or large exhibitions areas. Next one is the skill-based livelihood opportunities. Many of time in village, sometimes of youth also, women also have different kind of skill sets. So what are identifying their skill sets and helping them to through their machineries, through their capacity building for the implementing their skills on large scales, and their skill converts into earning more amount of money for their fulfill their requirements or dreams. So key livelihood intervention opportunities here water has promoting goatry, poultry rearing, dairy farm, then is a fishery farm. The fishery farm mainly for the fresh water fishery farm, not here for a marine fishery farm. So whenever goatry or poultry water is promoting livelihood activities, water giving training to the that particular beneficiaries about their task, goatry or poultry. So before that, when we are giving poultry rearing, so water giving exact hatches number of hens before the train the people. So when you are giving 0 to 21 days hatches hens we are giving to the beneficiaries, and then some types of breeding varieties also giving to the poultry beneficiaries like Kaveri, Giriraj, Vanraj, Sonali. Such type of variety, breed variety are available throughout the nation for the uh, large amount of productions, which is totally different from the hybrid poultry, which we getting from the chicken like that. It's not such type of poultry. This one is a uh, local based breed Giriraj, Kaveri, Vanraj. This one is a very famous, and it has good capacity for the fight against viral or fungal disease, which is major disease in poultry backward poultry backward rearing type. Next time, the dairy farmer are what are also giving the opportunity for the every youth and women farmer about the establish of dairy farm within the villages. So we have many example right now within one village, more than 5 to 10,000 milk collection where water is working. Milk collection center also established, train the people about the collection center, how to hygiene mode, and all these things has been covered. And I'm proudly saying water in Marathwada, Vidarbha, and also Western Maharashtra have producing everywhere water is working more than at least on an average 2000 liters milk has produced from the single village, and water working right now more than 8000 villages. So it's very proud moment for us to we are contributing the nations through promoting livelihood activities like goatry, poultry, dairy farm. So beside that, some this is one is the snapshots of the livelihood activities. Goatry, then BRC center, um, crafted bamboo. Then is the kitchen garden. The water is promoting for the nutritional supply to the women's also and males also for the household. Along with uh, livelihood activities, agriculture-based livelihood activities, water is promoting like that. Orchard plantation means mango. Then floriculture and green garden farming. Also, water has promoting. Another is a vermicompost. Nowadays, the chemical fertilizer has been very expensive everywhere. So, water also identifying this issue, and not only the expensive of chemical fertilizer is not only the expensive, but also it's affect negative impact also human health and our soil health. That's why we are promoting every village vermicompost unit uh, for the production of the large scale of the organic manure for the to provide supplement to the plants. Also, green fodder also has promoted through the every villages. Uh, So non-timber NTPF activities like that, cashew cultivation processing, honeybee collections, apiculture, beekeeping, collection of bamboo from the forest like that, also such type of activity. Uh, water has also promoted in the Orissa area, Orissa state, where forest area is very high. Another is a skill-based area where water rural micro enterprises is promoting throughout the villages. Like that, in first picture, you can see the women is uh, busy in their activities like that, tailoring. Second image is the processing, dal mill processing. We have also set up in many areas, dal mill processing for the uh, Marathwada and all other part of the Maharashtra. Dal mill processing unit has established where is the pulses growing area is very high. Not everywhere we are installed this such type of unit. We are identifying the key process or key raw material available, and accordingly we are set up the unit for the promoting rural enterprises. For example, in Konkan area there is a paddy is a very high area or large amount of area. That's why we are giving machinery or machinery regarding to the processing unit of paddy, where pulses has prominent area. We are providing farmers, we are providing women's through the dal processing unit. Sometimes, so beside that, in a dairy farming, the fodder is a very big challenges for everywhere. So the silage is the better option for the where the scarcity is occur or providing a right proper fodder for the cattle to the getting proper amount of milk from them. So we are giving training for the how to prepare silage for the farmers. Here I have added some Gemini's photos or for the understanding in very easiest format. So that's why keeping this image, and last two bottom gunny bags, this one is the original image from our villages. So before giving any kind of livelihood activities in the villages, for example dairy farming, we are identifying what is the raw material source for the fodder purpose in this village. If there is scarcity for the fodder purpose, then we are training, we are giving training to the youth also, farmers also, for beneficiaries also about the how to prepare fodders or silage for the uh, within the village to fulfill the fodder requirement for the cattle. So you may know about the silage, but I can explain little bit. Silage means the full nutritional supplements for the cattle, which is we can store 45 days in airtight condition for the proper fermentation process. So after 45 days, we can use it for the consumption or giving to the cattle for the eating purpose. So you can see the process of in this image. Once we maize our sorghum, we can select for the silage preparation. Next one is the vermicompost production. Means in village right now, demand has now increased everywhere for the our awareness has increased about the organic farming. For organic farming, raw material or organic fertilizer is the key assets right now. So awareness has also increased for the uh, applying of organic input material for the crops, also getting good amount of food from the soil. So we are promoting vermicompost unit in at least five farmer from the every village. We are also giving training about that how to prepare uh, vermicompost on the farmers level. So before that, we are giving any input or any material to the farmers by the free of cost. We taking their belief, we are getting consent from them. You should get involved everywhere for the doing agriculture activity instead of getting free someone's कोई आएगा और कोई हमें बताएगा, तो ऐसा हम फार्मर के साथ नहीं करते. So directly we are giving training about that how to prepare vermicompost, what is the essential key things for the preparation of vermicompost, like earthworm, cow dung, dry leaves also. This one is needed for the everywhere. Or we are giving guide them to step by step, means prepare bed, apply dry matter over the bed, add base layer about cow dung, then alternate cow dung one layer, alternate dry leaves or crop waste one layer. We suggesting to prepare such type of things to the farmers or also beneficiaries. So they can produce large amount of vermicompost and they can sell within village for 2500 per ton, या फिर 150 kg 500 600 rupees, like that. So farmer can get also benefit from the or also get a reward from their hard work. So this one is the setup for the BRC. BRC means Biological Research Centers, which is totally organic. It's help for the plant protection also and providing nutrition for the soil. Uh, 5 drum for we can here is the pest control activities we can also cover. A nutritional requirement for the plant also we can cover here. Also disease control activity through organic way we can control through the promoting of BRC, Biological Research Center. So this one is a very useful for the farmers. We have also success case study about the BRC, how helping farmers for the getting chemical free, residue free food from the soil also, and keeping environment free by using BRC input on their crop. So for BRC setup, we need 20-25 farmers, interested farmers. We are giving training about that, how to prepare bio input material, business and marketing, all these things. We are selecting product like input like Geomrut, Dasperniak, Trichorama, vermicompost. This one is essential for the whole cropping pattern. It will help keep our plant disease free, pest free from the uh, bio input like that. So raw material like cow dung, cow urine, neem leaves, jaggery basin, it is needed for the BRC. So total estimate cost needed for the 50 to 60 thousands on very strong infrastructure. I am saying here, you can start it 5,000 to 10,000. So you can produce more than 5,000, 10,000 liter input material on your own farm, or you can sell it 200 to 205 per liter cost. So farmer also getting the organic input for their crop. You also getting livelihood opportunity at your village. So this is the glimpse from our field, how women also helping for the uh, preparation of bio input from their end, and also they selling through uh, nearby farmers, so they get right amount of right portion of input material for their crop. Sometimes we are suggesting you can use organic material, but farmer problem is not getting everywhere organic material. So he intentionally moving towards the chemical product because of they not get any organic product in their native place. That's why we are promoting BRC in every villages to get organic amendment for their crop and for their soil. So this one is the component implementation step. What should we follow before the BRC setup? Select suitable BRC location and train local resource person. Install awareness board, wall painting in the villages like that. Promoted biological inputs through women-led SCGs farmer. If you are promoting such type of biological input through active who women is very active in your village, so you can get mouth publicity within where you are establish your bio research center. Or bio research centers, you don't need any different skill or education in from master background or chemical chemistry background. You don't need. You just need a 10 pass out a student or youth, or you can you we should give the training of to the youth about the BRCs, and he will handle the whole things after the he get full idea. Challenge faced by BRC, sometimes we are strong local preference for the chemical farming, uh, limited technical capacity of BRC staff initially. Once this capacity has built, then this challenge will erase. Farmer hesitation due to doubt about biological input performance over their crop. We have built our mentality through multinational companies using chemical farming only give a good amount of yield, but the reality of scientific background is totally wrong. For breakdown of any chemical material is helping the bacteria. Bacteria is the main reason for the any chemical or any nutrient convert into available form to the plant. That's why we need bacteria or BRC producing more bacteria for the convert raw material into available material. That's why this component is very demanding right now. Government of India also promoting BRC setup throughout the nations by giving subsidy then. So our target is the rural youth. Everywhere right now, the rural youth diverts from village to city for the another job. No one ready to work with agriculture. for agriculture allied activities. So water is targeting rural youth for the stick them for the align with agriculture activities. So rural vulnerable households, tribal marginal households, the key focus for us to promoting such type of activity to through the villages and through the district levels where water is working. So way forward livelihood as a path to recovery, integrating nature-based livelihood in a mental health rehabilitation, agriculture and dairy activities can provide structure and meaningful engagement for the recovery individuals. So I already told that agriculture is the very emotional service for everyone. So it's help mental healthness patients for them to engage their throughout the days through agriculture activities. So livelihood approach to help rebuild confidence, dignity, and a sense of purpose to the who are working with them. So farm-based activities promote routine, responsibility, and connection with nature for the who involving with them throughout the days. So skill development and livelihood training can be enable individual to achieve economic independence to the farmers also, rural youth also, mental illness health persons also, or everyone who can align with their activities. So thank you for your attention.
Sachin, I think you can close. I think you presented very well. The purpose of the today's presentation, and also your portrait about the your organization, what is actually doing. Now it's open for the discussion and question answer from the participants. Any clarification? I think what we learned from your presentation, many of our students and PhD scholars and residents are there, and even caregivers and persons with mental illness. So these people will understand which area I am going to fit. And second, I realized that with your presentation, it is not persons with mental health conditions also can involved in this kind of activities easily overall on medication overall can able to maintain their stable symptoms. uh, with this, I think I'll encourage the students. Okay, you may be having many questions, or this some of the students may not aware about agriculture background. uh, this is purely and rural background he has presented. This can also experimented briefly in urban area or some semi-urban areas, which is having little land. So, but it's suitable for rural areas.
Yes, this one also suitable for the rural areas. We can train them about the kitchen garden like that. So in rural area, kitchen garden is very easy to doing livelihood based activities or multi-layer farming also for them to produce their own vegetables also food also on their uh, territories.
You can also ask in chat box. I think they may understood well with your presentation. Yeah, somebody is raising. Please go ahead.
Yeah, terrace farming also helps in the urban areas, right? Apart from the kitchen, terrace farming also helps.
Terrace garden, I think good. Yes.
Yes. Kitchen garden means kitchen garden. The terminology used in the rural area where is the uh, 2 to 3 hour area available for them. In English, we can say 2 to 3 guntas. But in urban area, we can kitchen garden rename as a terrace garden. It's
No land, no. That's the reason we are going
yes.
there.
That's why. if you have any much more or question regarding the presentations or allied with agriculture, so we are open for the discussion.
I think many things we learned, Sachin. We can also refer,
Okay.
and we can also type with the, or we can able to network with you. You and
Okay.
CPM. You people are doing really good job, and uh, uh, we learned actually from you some of the skills and programs, how we can able to refer and how we can able to inform some kind of information, especially sheep, goat, fishing, and really good. And you mentioned one other area. Based on the availability of the raw material, we have to plan and we have to inform. And think
Yes.
Rachana Mittal, please go ahead.
Yes, I wanted to ask how can we help such people in urban areas more than the kitchen garden, or how, and also how to approach and whom to approach, especially for those people who are who have the normal mental IQ, but they have kind of personality disorders where they cannot work with a company, or they cannot have a blue collar job, but they would be very good for physical work. And so I wanted to know whom to approach.
Thank you, Rachna ji. You are asking very good question. I mean, for my side, for your urban area, it's very difficult to identify the key helping person for the who are ready to working with the terrace garden like that. So I think any urban NGO will help them for the uh, to promoting their skills on the large scale, also helping to the skill set or capacity building program. Like, thank you.
Yes, I like the person I'm asking for is a intelligent person, so he could also help in training other people. So how do we get into this line? That's what I wanted to
Uh,
ask.
Archana, I think with my knowledge, the GKVK is providing a training program for the terrace garden.
Can
For
you tell me? Sorry, I didn't get the name.
GKVK, that is Agriculture
University.
University in Nepal.
Can
Hmm.
you put it in the chat? Could you text that name in the chat, please?
Yeah, I will put it. You can
Okay.
take GKVK. It's a Agriculture University in Nepal.
GKVK University in.
In Nepal.
Okay.
Hebbal, you are from Bangalore, you can understand where is Hebbal. Hebbal nearby Yelahanka in Ballari Road.
I'm from North, so it's all right. If you could just text, I will find out the details
Or
online.
nearby your place, any agriculture university, you can check. That will be
Okay.
useful.
All
I'm
right.
talking about Bangalore related thing. You may
Sure.
check any agriculture university.
I think we have one in Ludhiana. I can check there. Yes.
Yeah, yeah.
Okay. 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 Thank you so much.
Thank you.
Thank you.
Any other? If there is no question, I think thank you for both the presenters, Rufus Singh and Sachin. I think you presented, and even Shiva Mohan Rao. Three presenters presented meaningfully with the stipulated time. And also, I should thankful my PhD scholar Sri Darshini and Dr. Ramakrishna, who has background work has done. I think these people has contacted you or prepared these flyers and contacted many participants, and they have circulated this information. With this, I think I think it's made a meaningful impact on the today's program. We will looking forward. This is a beginning actually. We will contact you further details. Thank you for the opportunity you are also giving for us to introduce your programs and planning to the our students and our caregivers as well as persons with mental illness. With this, I will wind up. Thank you.
Thank you, sir. Thank you, sir. Thank you.
Thank you, sir. Thank you very much for this opportunity.
Thank you.
Thanks.